little bit more, but never as a ghost, as a duck or whatever. And biostimulants, they are growing more and more here too. But I love your approach. You were always talking about naturality, safety, no strange mixtures. For example, a Sculptra and a Lance. Maybe one time Sculptra, next time months after another one, is it?
Indeed.
But you said me about skin sagging. Yes. And then I remember the name. This is thread. I know you have a very good experience with threads for face.
Yes.
How and when do you decide to use threads?
Threads. So first of all, if I have once I have the patient in my clinic, we discuss all the treatment options, and I use threads if I see that my patient is not how can I have hypochondriac. So if it's someone who is trained with the aesthetic treatments, and if I see that it is a loss of volume and also a moderate skin sagging, but not a severe, because if it's something severe, so we have to perform surgical lift. Yeah. And in this case, I prefer to use threads, and sometimes I can combine threads with hyaluronic acid. It is very good, and I combine
at the same day. No.
Yes. You
do the thread and then filler.
Yes. But not in the same place. Example given. If I put the threads on the middle and lower face, I can feel the nasolabial folds with hyaluronic acid. Not in the same place. Never in.
Maybe on the jawline.
Yes. Yeah.
Oh, yes. Do you remember in Dubai we were discussing the term Texas technique? There are a lot of names. People, they are listening to us. Maybe they are thinking about Texas technique or Milano technique or Tokyo technique. It doesn't matter. Yes. And at that time, Texas technique was exactly the jawline definition.
Yes.
So it's very interesting, Dr. Ingolda. So you can use at the same day the thread, for example, and then at the same moment, or even some minutes after, nasolabial fold and jawline. Very nice, huh? Oh, your microphone.
Excuse me. It was a small problem with the connection. Now I'm back. Excuse me.
This is the Atlantic Ocean.
I like it. Yes. And yes, we were speaking about the combination for threads and hyaluronic acid, right?
Mm-hmm. Yes, we were talking about that. Oh, there's another problem between us, the Alps. Maybe yes. The transmission is trying to contour the Alps yes. and come to Brazil.
Maybe, yes.
But
yes.
tell me, I know you have some options. In Switzerland, you have a huge number of options.
Yes.
Threads, yes.
Yes.
Tell me, what you prefer, PDO thread, PCL, what kind of thread do you use?
I always start the first treatment, the first time that I perform thread lifting, I prefer to work with PDO threads because are very the time that it is needed to resolve. It's very short, and it is not something that it's big, because between us the patients are how can I say, they have are very anxious if they heard about thread lifting. So I start always with the PDO threads, and I perform 3 or 4 or 5, but not more than 5.
Always the direction like
yes.
a facelift.
Yes,
maybe.
Yes.
So PDO always. Generally, you begin with PDO.
With PDO, yes.
For those, I'm sorry.
Excuse me, I didn't hear you.
No, I was I supposed to say that PDO generally for people here in Brazil, we say this is the Korean thread. It comes inside a needle or a cannula, and you simply put it and remove the needle, and the thread stay. Is it the PDO you use?
No, there are 3 types. There are the mono threads that I use it, example given, only in the periocular area in order to make biostimulation, the simple one. There are also the screw threads that I use it if I want to achieve more volume. And there are also the cork threads with barbs that I can also lift. So I insert the thread and I lift, yes. And as we know, these threads have biodegradation about 4 to 6 months. And I see my patients after, and we speak together. And of course, if they need a more long-lasting effect or more collagen production, because we know that the PDO threads have the limits, after I work with PCL threads or PLL threads, so threads with polylactic acid or polycaprolactone. But
polycaprolactone is the same material of Elance.
Yes.
Isn't it interesting? And PLLA is the same of Scoptra.
Yes.
Look how interesting we are living in. Things they are making as a complement of treatments in the name of the word, the sacred word, collagen. Isn't it?
Yes.
Isn't it fantastic?
Yes, I love it. And you know, also the patient, because after the treatment, they don't see so much difference because there is this swelling and maybe hematomes. And they called me after 3, 4, 5 months. They go, "Oh, Dr. Ingo, it's getting better and better and better. How exciting it is." And
very nice. Yes. And I talk to my patients the same. Sometimes differently from another procedures where we simply cut and make the suture, collagen stimulation comes with time.
Yes.
Isn't it?
Yes.
And at this point, Dr. Ingold, I want you to listen to your opinion about the coverage. In Dubai, we were discussing about the cover of the face. It means the skin.
Yes.
And I know about your experience with chemical peels, PRP, and skin boosters.
Yes.
Tell about this world to us.
The first consultation, during my first consultation with the patients, I invest a lot of time, and I explain to them that we don't have a magic treatment. So we don't have a treatment in grade to resolve all the problems. So that it is like a puzzle. So we have to work also, and we have not only to protect our skin, but also to stimulate our skin. Because if the skin quality is not good, if I have a skin with acne problems or with hyperpigmentation or with small scars, and if we perform fillers or threads, the patients are not going to be happy at all. That's why I instruct them, and I tell them that we have to work in multi-layer technique. And it is very important to take care of our skin. Take care means not only to put creams every day, but to help our skin to exfoliate. Because as you know, there are different layers on our skin, and our skin has the magic property to regenerate very fast. That's why if we remove, if we exfoliate, if we peel the upper layers of the skin, new skin it's going to be created, and new skin means healthier skin with more luminosity, with less problems. And in order to achieve this, I use very often chemical peels. And as we know, there are three types of chemical peels: superficial, medium, and deep. And in our clinics of Ingold Aesthetics, we instruct our patients how they can make alone at home the superficial chemical peels. And after a couple of weeks or more, it depends on the case, they come to our clinic and we perform at last one medium chemical peel. So once the quality of skin is better and have a little bit of luminosity, after we start to work with hyaluronic acid products or with red, the biostimulator, botulinum toxin, and the rest, because it is very, very important.
And what kind of chemical peels do you prefer? You know, because Switzerland, of course, the world today is mixed.
Yes.
It's quite difficult for us to say that in Europe the skin is light and safer for us to touch and to make peels and lasers. And South America, Brazil, Middle East, and Africa, India, this is less safe because we are mixed. But of course, generally, population in Switzerland, they have the higher level of white skin, let's say.
Yes.
Here in Brazil, we have a mix
Yes.
of colors, let's say.
Yes.
What kind of chemical peels generally you prefer to start?
I start always with the glycolic acid, because we have different concentration of this chemical peel, or salicylic acid or lactic acid. It depends on the type of skin. And after once I want to perform needle deep peeling, I switch to a glycolic acid with higher concentration, or I use also
70%.
Yes, 20 to 30, sometimes also 30%, because they perform at home until 10% alone, and we instruct them in our clinic how to work with because chemical peels can be very dangerous.
Yeah.
And we, with the medial deep peel, I perform also TCA 10 to 15%, but not more.
Yeah.
Yes, with TCA, because in Switzerland, especially in Zug, where I have my other clinic, there is a mix of population. So we have a lot of Asian people, and the Asian skin is very, very fragile. So, and has a tendency to post-inflammatory hyperpigmentation. That's why I stay very careful with the TCA.
And this is very important, because some people, they think that this is not as important as we say. Some people, they do not prepare the skin before the peel. Some people, they never use sunscreens. And this is a big problem. And unfortunately, some people, when we have a spot, for example, they never assume that they didn't use the sunscreen. So chemical peels, we must be aware of the safety before and after the procedure for avoiding the post-inflammatory hyperpigmentation, as you said.
Yes, 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 indeed, yes.
Yeah. And what you told me about PRP. PRP is plasma-rich, platelet-rich plasma.
Yes, yes.
This is obtained by the patient's blood. We centrifugate the blood and remove the cells and take just the plasma with collagen.
Yes.
Skin booster, as you told us, this is made using hyaluronic acid.
Yes. And
how do you select chemical peel, PRP, and skin booster?
I try to perform always chemical peel. I love chemical peel, so and I think every patient in every age needs at last a chemical peel. I love it. And because it's the concept of getting skin ready, because if our skin it's not good exfoliated, even if we put the best cream on the market, it's not